Hello, I'm Dr. Ellena, and welcome to the Department of Anatomy and Cell Biology, where the TSAM project operates from and seeks to improve health systems. The training, support, and access model for maternal, newborn, child health in Rwanda and Burundi strives to improve maternal, newborn, and child health through health systems change. I first became involved with the project in January 2017 as I finished my graduate studies in international health and development here at Western University. Much of my research focused on assessing the social, health, and economic impacts of a community-based probiotic yogurt project in Kenya. But I had also worked in Tanzania, had done some work in South Africa as well, and had traveled to a number of other African countries. I am of Cypriot heritage, born and raised in Canada, but have always had a profound interest in Hispanic heritage and culture. I have always had a interest in Hispanic culture, but over the last several years, it seems to be expressing itself increasingly through a number of professional collaborations with a vast group of Colombian colleagues. And this has also been nurtured, in fact, by a number of trips to Cuba. Well, interestingly enough, I had the fortunate opportunity to experience international healthcare for the first time in Cuba as a tourist during the period that has now become known to be Cuba's Dark Ages. It was in 1993. Russia had pulled out of the country several years prior. Subsidies had stopped, the US sanctioned embargo was in full force, and there was rationing of almost everything: electricity, fuel, basic necessities. Of course, as a tourist in a hotel, you weren't missing anything, and you wouldn't come to notice this unless you were to venture off the resort. One fateful night, during a blackout at the hotel in Cienfuegos, my father slipped, fell, and fractured his hip, and so our medical journey in Cuba began. An ambulance ushered him to a public hospital, which was immaculate, and x-rays were taken on an antiquated yet functioning machine, and after that we quickly learned from the radiologist that he had fractured his hip. They decided to immobilize his leg to prevent further damage using a cast, and the following day we would be transported to a private clinic for further diagnosis and most appropriate course of care. The following day he was transferred to a beautiful seaside private clinic. Medical equipment was by no means in short supply. The contrast between the public and the private was stark. However, one thing had crystallized in our minds, and that was the level of care, knowledge, and skill of all involved. It was truly impressive. We learned very quickly that the Cuban health system is one that is systematically planned. There's an organized primary care delivery system that captures the essence of what doctor-patient relationships should be like. And health professionals, both doctors and nurses, are committed to their craft and their patients, providing optimal care and services to their patients with a warmth that is second to none. Even though years of rationing due to the embargo has meant shortages of equipment, antibiotics, and technologically advanced diagnostic equipment, and equipment in general, they are still able to provide care and services to their patients that rival many other countries. In fact, I'm not surprised. There's a long-standing history of Cuban health professionals traveling overseas to provide health services. Cuba sent its first doctors overseas as far back as 1963, and to date has sent physicians to over 100 countries. Cuban doctors and nurses are very well trained and are able to provide preventive and important primary and emergency health care in resource-limited settings. Over the past 50 years, Cuba has consistently sent health professionals to other parts of the world, building goodwill and forging strong relationships with emerging countries. Health diplomacy is a powerful tool. In fact, according to Forbes, 37,000 Cuban nationals are currently working in 77 countries. Absolutely. This cross-cultural learning exchange between countries and professionals is an all-important component of capacity building for both sides. Regardless of background, we all have knowledge that can be shared and applied in a variety of settings. Capacity building through knowledge and skill transfer not only aids the student directly, but the student will eventually become the practitioner, providing training and mentorship to their future interns and colleagues. While this may not seem to be a significant contribution to overhauling national healthcare systems, it certainly does have an impact, at least at the micro level, within the hospital community and within the patient community. Interestingly, the school is also fully accredited by the Medical Board of California, which applies and maintains the strictest U.S. standards, demonstrating that Cuban institutions and health professionals are at the top of their field and are able to provide high-quality education and training that would not otherwise be available to these bright and committed students that would not otherwise have access to advanced training. Further, Cuba's health paradox demonstrates that health for all can be achieved, even in resource-limited settings or with severely constrained financial resources. This is of critical importance and a valuable lesson for those from low and middle-income countries training abroad. Oftentimes, there is a perception that the wealthiest countries have the best health achievements and outcomes as a result of the amount of money spent on their healthcare systems. However, Cuba is a prime example of how to achieve this and how to do it well. The government focuses on key non-medical or social determinants of health to start. We have the world's largest number of physicians per capita, which is about 1 physician per 250 patients, centrally planned office locations, and a physician team responsible for the health of its citizens within a specific geographic area. These are all valuable facets of a system that can easily be adopted and adapted to other settings. Overall, the school's mission and vision, which focuses on accepting applicants from low-income, impoverished, and/or medically underserved communities, even from the United States, truly aligns with Cuba's core values, particularly that health is a human right, and this is an important message in and of itself globally.